And now Pfizer back in the news after CEO Albert Bourla said that people will need a fourth dose of the vaccine. That tops News 19 at 4. I'm Christine Killemeyer.
And I'm Jerry Hayes. While Bourla claims that the third dose works extremely well against hospitalizations and death, he says the protection against infection after a third dose is not that good against a variant like Omicron. News 19's Yvette Sanchez joining us now live outside of Huntsville Hospital with what state health officials are saying about the possibility of a fourth dose. Yvette?
As you mentioned, that fourth dose as of today is a possibility for those who are not immune compromised. Currently, the CDC recommends a full series of the Pfizer vaccine and then 5 months later to receive your 5 months later after your 2 shots to receive your booster shots. Now, while all shot series can be different from others, a fourth dose all depends on the person. For example, people who are moderately to severe immunocompromised received 3 shots as a part of their initial series and then a 4th shot as a booster. But doctors say most only need a 2-shot series and a booster. Dr. Wes Stubblefield with the Alabama Department of Public Health says if approved, this 4th shot would act as a secondary booster for most people.
The company has said is that they think another dose will be needed. Of course, it really comes down to what the FDA and CDC would say in response to the data that they're submitting.
Dr. Stubblefield added that the vaccine does not cause permanent immunity, and the same goes for those who have had COVID-19. The Alabama Department of Public Health does follow the guidance of the CDC and the FDA, which have not released anything saying that a 4th dose would be encouraged. Live in Huntsville, Yvette Sanchez, News 19.